Many people are confused when they look into long-term care with the expectation that Medicare will see them through their later years. Yes, Medicare offers help with medical bills and hospitalization, but Medicare's contribution to more concentrated care in your elder years may not be what you expect. What exactly does it look like? Hi, my name's Keith Manning. I'm a licensed healthcare administrator and an ordained minister. I'm interested in helping you care for the whole person. Medicare and Medicaid have been around since 1965, when President Lyndon Johnson signed the bill that led to their creation. There are now 4 types: A, B, C, and D. Together, A and B are known as original or traditional Medicare. Part A is sometimes referred to as hospital insurance, but both it and Part B can be utilized in other settings, such as rehab facilities, hospices, and long-term care settings. Part D was added in 2003 to cover prescription medication costs. Medicare Advantage is the common way to refer to what used to be called Medicare Part C. Medicare Advantage effectively bundles Parts A, B, and D. In 2023, for the first time, Americans aged 65 years and up chose to enroll in Medicare Advantage above traditional Medicare, and a study by the Congressional Budget Office projects that this trend will only continue. But this is not necessarily the wisest choice for everyone. While traditional Medicare is run by the federal government, Medicare Advantage is subcontracted by the government to a wide number of private insurance companies. Those companies decide which services will be covered and by which medical provider and for how long. For example, both traditional Medicare and Medicare Advantage will pay for short stays in rehab or skilled nursing facilities as long as it is deemed reasonable and medically necessary. But Medicare Advantage often has set limits on the number of therapy sessions one may receive or a maximum dollar amount that it will allow to be spent on therapy. By way of analogy, the differences are similar to choosing between an HMO and a PPO. Traditional Medicare is accepted almost everywhere. Medicare Advantage is not. And Medicare Advantage requires pre-authorization to use, whereas traditional Medicare does not. Traditional Medicare has higher upfront costs with low copays. Medicare Advantage has low upfront costs and higher copays. Someone on managed care may be discharged from a skilled nursing facility or rehab facility sooner than they or their doctor would have liked, simply because the Medicare Advantage company decides to cut off payment. This becomes significant when considering long-term care. Mark Parkinson, the current president of the American Healthcare Association, points out the problems this creates for medical providers. He explains that when managed care networks control length of stay in a rehab or a skilled facility, those stays are much shorter and reimbursement is much lower. Parkinson points out that very few Medicare Advantage plans pay anywhere close to the full rate that the facility actually incurs. What does that mean for you? A business that gets reimbursed for less than what it spends is not going to be financially stable. They're going to have to cut corners. They may employ fewer staff, and those staff members have a heavier workload. The buildings and grounds may deteriorate. They may delay paying their vendors. Those are not the kind of facilities you would want for yourself or your elderly family member. So what are your real options? Medicare Advantage is great for fit, healthy, active seniors. But if or when they get sick, its limitations become very clear. The good news is you can switch from one plan to another during the open annual enrollment period. You might want to think about doing that. For many, it's critically important to understand that Medicare is not designed for custodial long-term care, that is, living in a nursing home. That is what Medicaid is for. But that's a topic for another video. We have more content about improving quality care for our elders. If you find this helpful, follow for more.